So our whole team at the Baby Academy is here for you to answer any questions that you have along this entire parenting journey, right? So I'm here today for you guys to support you in any questions that you have related to baby care. It's all about baby care this morning. So there are 8 topics. We'll do the first 4. We'll do a live chat and then a quick break, the other 4 topics, and then another chat at the end. Super helpful though with the first chat just to ask me questions related to the topics we just covered. That really helps very much with flow, and then we can open up to more general questions at the end if you like. So as a midwife, I know how important language is, whether we're conscious of it or not. I'm going to use the term partner today to refer to your plus one. I hope that each and every one of you has a partner that's going to go on this journey with you. Obviously, my partner doesn't look like yours, and so on. Hopefully, there's some partners here this morning. Welcome all. There is time for a break. It's usually around 10 minutes. Depending on how many questions we have. So my name is Emily. I am a nurse practitioner and certified nurse midwife that catches babies for a living. I'm so lucky. I love my job. I started out as a registered nurse 23 years ago. Whoa. And I spent most of my bedside nursing career in the neonatal intensive care unit, taking care of teeny tiny sick babies, preemie babies. I then kind of figured out where my real home is, which is labor and delivery. I love watching y'all become parents. It is such an honor every time. I started my journey to being a midwife about 10 years ago. Since then, I've worked in a freestanding birth center. I've worked with a private OB in her practice, and now I work as a hospitalist in a city, kind of seeing everybody who comes in the door. Never a dull moment with that job. So especially in my current job, I see what an impact education has on your experiences and your comfort level and just how you do, right? I am here for you. I love women, and I'm here to kind of help empower you with information. That's why I do this. I have 2 kids of my own. They're 10 and 12 years old. So all that to say, the stuff that I share with you today is based on my experiences as a clinician, but also a couple of mom hacks along the way. How about you guys? Where are you from? What's your name? When's your baby due? We'll do a quick little hi in the chat. Tell me where you live. This is usually my West Coast class. Anybody having twins? Hi, Sarah from Denver, due in July. Thank you. Heather from Colorado, congratulations. We always have at least one person from Hawaii here. Erin, hello. First baby due in September. Alana from San Diego. All the summer babies today. Alejandra, we have an October baby. So y'all, our content is really built out for first-time expectant parents. I'm going to teach you how to take care of your babies. If you've never put your hands on a baby before, you don't really even have to be a baby person to be really into your baby. That's handy. So no worries there. Hi, Sarah and Darren from Colorado, due in September. We are in our, I can't believe I'm saying this because I have to work tomorrow, our slow season in birth, and it gets really busy no matter where you live in the end of this summer through the fall. People love to have babies during that time, and your due dates are kind of tracking for that. We're ready though, don't worry. Hi, Katie from New Mexico, welcome. I wish I could say hey to everybody. Hi, Megan and Ricky. Congratulations on your first baby due in June. Okay, let's get into it. All right, so all things baby care, right? I will demo how to bathe a baby. We'll talk in particular about how to bathe a newborn and what to do about that delicate skin, how to help that skin adjust to being here, how to trim those teeny tiny fingernails, how to change a diaper, what the deal is with the umbilical cord, what the stump is, when it's going to fall off. How to dress your baby according to where you live. You guys are from all over the place. We talk about safe sleep and SIDS prevention, very important. I'll do a demo of swaddling. We'll talk about how long you should swaddle for and temperature control. So first topic is bathing your baby. This is definitely not a newborn here. I want you guys to really look through the lens of newborn, and you'll see why. So this is definitely a newborn in this picture here. So we recommend that you just bathe your newborn once a week. Okay, I know what you're thinking. Bear with me. Many of us bathe every single day, but your newborn has a period of adjustment to go through. That skin is so velvety and soft when you're going to love to just, it's so sweet. Anyway, I digress. Your baby is an aquatic being right now. They're inside the uterus, floating in amniotic fluid. That skin is surrounded by water all the time. When they're born, of course, they have to adjust to the external environment, the open air, all the things we see and we don't see. So it's nice to take care of that skin a bit differently in the beginning, which means just watching them once a week. So your baby's very first bath, my details people out there, we recommend, the World Health Organization too, recommends that you delay the baby's first bath by at least 24 hours. So there are some physiologic reasons for this. So brand new babies who are bathed right away can have a little bit of physical stress by way of, they get cold, right? They can have some temperature instability, blood sugar instability, believe it or not, while they're trying to get warm again. We know that babies who are trying to learn how to breastfeed, learn how to latch at the breast, are better able to do that if you haven't bathed them right away. It's something to do with the smell, the amniotic fluid smell that you're preserving and not disrupting, right? Helps them latch a bit better. So you could even delay that baby's first bath the whole time you're in the hospital space, up to you. We know as clinicians that there are benefits to that, so we're not going to look at you like you're crazy if you say no bath at all, but you have to let us know. So the correct water temperature is really going to simulate the environment they're in right now, which is core body temperature, 98.6 degrees. That's what you want to go for your bath water. If you're not sure what that feels like, we take hot showers, right? So they have these little rubber duckies with a digital thermometer embedded in them, and you can just put that in the tub and see precisely how warm your water is. Or if you want to just spot check it, make sure you're spot checking with the delicate part of your skin. These fingertips are not as sensitive to temperature, right? So you want to make sure you have everything you need before you get started. It's a nice idea to just get two of everything. Probably won't use all that stuff, but nice to just be prepared just in case something gets peed on or something. A couple of bath towels, stack of washcloths here, some cotton wool pads, makeup remover pads, definitely a fresh diaper and a fresh outfit within arm's reach, and your vessel, whatever tub you're going to use, whether it be this gigantic one or something else. Oh, that was not graceful the way I put that down. So you want to avoid any bath products until baby is at least 4 to 6 weeks old. Let's go with a month. So these bath products, right? So I know it might seem kind of strange to just bathe your baby once a week in clean, warm water, but the soap is, even if it's marketed to be gentle and for babies, has a whole list of ingredients that are brand new to your baby. And you don't want to expose that skin to all those new things in the beginning that can dry out the skin and leave their skin more susceptible to skin sensitivities and rashes in the future. So the other thing too, backing up to when they're first born, babies are born with this white, creamy substance on their skin called vernix, and it's almost waterproof. It's really great stuff and tailor-made to your baby's biome. You want to make sure that that's soaking into the skin if you can. You don't want to go purposely soap and washing that vernix off. So once they're a month old, you can bathe them as often as you want and use all the products in the world, but really does help set that skin up to be resilient and less prone to being sensitive and rashy in the future. Who doesn't want that? So every day you can wipe behind what I call those high traffic areas, which is right here. So what happens is when you feed your baby and they're satisfied, a lot of times they'll hang their mouth open and milk will dribble out of the corner of the mouth and settle into these little yummy neck folds here. Over the course of a day, this can make for kind of a sticky, sour situation. So you'd want to wipe down the neck and the face on the daily, but you don't have to wash them every day. Babies love to suck on their hands. Preemies like to suck on their hands too, interestingly enough. They'll continue to do that when they're born So you can wipe those little hands down every day too. So let's have a bath. All right, so I love this picture here because this is very representative of a squishy newborn baby and the level of support that they will need from you during bath time. This baby bathtub, you don't have to have something like this, but I grabbed this for a new parent that might feel a little nervous about bathing, nervous about everything really. This has a little insert that you can put your newborn on and give them a sponge bath. That's fine, right? You don't have to submerge them in water if you don't feel ready for that yet. Or you can just pop this thing off and put baby in a more traditional baby bathtub. This has non-skid material here and a drain at the bottom. Of course, you want to have your hands on baby, be supervising baby at all times in truly any amount of water for safety's sake. But you fill this thing up about halfway, clean, warm water, 98.6 degrees. So if you live in a small space and you're thinking there's no way I can store this gargantuan tub, there are things called Lotus tubs. If you search in Lotus tub, you'll see it's basically a giant flower that you can fit directly into your sink, and baby goes right in the center of the flower, and they're supported by that material. You can bathe them in that space. When you're not using it, you can just hang it on the back of your bathroom door. That's a great space saver. Okay, so I want you to pretend that I'm in my bathroom. And with my kids, I would always just take a shower beforehand and get it nice and hot and steamy in there. Get that mirror fogged up, get the doors closed. Babies love a nice, warm, tropical environment. Where to put this thing? Okay, so on bath day, what I would recommend doing is kind of in sections. And so you want to do the head first. I would go ahead and undress baby, keep the diaper on, and you can just kind of casually wrap them in their towel just to keep more warm and comfortable. And so I'm going to wipe down the face first with my clean, warm water baby washcloth. So more specifically, cleaning their eyes. A lot of times newborns will have crust in the eye. It doesn't mean they have pink eye or any infection. It's very typical. If you see that, then just grab a cotton swab, either wet or dry, doesn't matter, and you can wipe from the inner corner to the outer corner of one eye, clean area of the swab, inner corner to outer corner of the other eye. Noses. So you want to resist the urge to aggressively suction in the nostrils. You don't want to do that just because babies really hate it. It can cause swelling. It's not effective and just makes them really angry. Unless they had like a big spit up and you see milk running out of their nostrils, I would just not do it at all. So you can simply wipe right at the nostrils, and that is good enough. As far as ears, you want to just wipe down whatever it is that you can reach with your finger is as far as you need to go. Q-tips, just like with us, are not recommended. The Q-tip can kind of pack that earwax down deeper into the ear canal and not and cause more of an issue. So no Q-tips in the ears, please. So got my face and my neck, and I'll do her head next. So see that I'm supporting her neck and her head by kind of having my hand at the shoulder blades, and I'll put her head directly over the tub. I'll scoop clean warm water over her head just to get it wet. And we're not really doing product in the beginning, remember, but if your baby has a head full of hair and you just have to shampoo, get it. Just a little dab of shampoo will go a long way. Get a nice lather. Babies love a head massage. You want to make sure, though, that you're really thoroughly rinsing this. I would get a separate cup and pour clean, warm water directly over their head until all that soap runs off. You might notice that these baby bath towels you have a really adorable but also very functional hood. So go ahead and pop that hood on there and dab dry the hair. At this point, you can just put her down on the counter, take that diaper off and you're ready to wash the rest of the baby. Okay, so I'm just going to go from top to bottom. I want to make sure I have a clean towel and a clean diaper within arm's reach, ready to go. Okay, so I'm just going to go from top to bottom, and yes, this is a sponge bath, but that is okay, right? If I'm going to do it this way, after I wipe down the chest, the belly, and the arms, I can get a spare washcloth, get it really nice and wet, and just lay that over her chest so that she feels a little more warm. That might keep your baby happy. And then you're going to do the bottom half, wipe down the legs and the genitals. And I'll talk in more detail about cleaning genitals in the diapering section, but you're really able to wash most of your baby from this angle here, of course, except for the back. So to do that, I would sit her up, and she's going to slump forward into my hands, just like the picture you see. I'm going to support her with this hand, and the other hand goes around and wipes down her neck, her back, and her bottom. Now, if I didn't have this insert and I had just like a typical baby bathtub, she's really not that deep, right? So if I did this halfway with water, it would come up to about here at the nipple line, and that's perfect. So whatever makes you feel more comfortable. Okay, so once you are done, you're going to scoop her up and put her directly on this towel here. And you want to try to dry the diaper area first, for sure, because your first priority is putting that diaper on, clean one. Once that diaper is on, you can move a bit more slowly to dry baby off. And you want to make sure that they're dressed before you leave the bathroom, because that will keep them warm. Okay. And that's really it. So a couple of things while we're here. How do you pick up a baby, right? These guys feel really intimidating to a lot of new parents. I get it. You need to put your hands on these 2 points of contact here. So supporting the top half of your baby is all about putting this hand at the shoulder blades, and your fingers will support the head. This is much more supportive than this here, obviously. The bottom half of your baby is best supported with the hand on the bottom. You could even grab the thigh with these 2 fingers here. So if you go to scoop up a baby, it's truly scooping up. 2 big wide open hands, scooping at the shoulder blades and bottom, and this baby is absolutely well supported. So bath time is really a great opportunity for you to connect with your newborn. Partners sometimes with newborns can feel a little disconnected because, say, maybe the baby's being breastfed and you can't breastfeed. Bath time is a great thing for you to claim, to connect with her. And so what I mean by that is you want to engage with baby's 5 senses. So her vision is not completely developed as a newborn. She can actually only see clearly from the distance from my breast to my face, which is really a sweet design by nature, I think. So you want to make sure you get in real close so that she can see you clearly. I want to make sure that I'm continuing to talk to the baby, even though it might feel a little silly. Your baby does recognize the sound of your voice. You can see I delivered a baby yesterday that was responding to her mom's voice. It was very obvious. It's very sweet. So you want to connect the vision of you to the sound of your voice. Partners, if you were around a lot the whole pregnancy, baby recognizes your voice too. So touch. I think touch is very important energetically. If you're having a bad day where you just feel frazzled and at your wit's end, hey, this is real life, right? If you're not having a good day, then just wait for the bath. Do it another day. It can always wait. You want to make sure that you're giving your calm energy to your baby. Okay. So when the time comes, your baby's here and you need a demo right away, we have all kinds of great demonstrative videos for you on our Instagram at the Baby Academy US. Give us a follow. We love to hear from you. We love your questions. We build out our content 100% off of what you want to know. So give us a follow. Let us know what's up. Okay, on to skin and nail care. So dry skin. Dry skin is a very common thing with an overdue baby. You've all been assigned a due date, which is 40 weeks. Some of you could go up to 2 weeks past your due date. If looking good, I don't wish that on you, but if you have a late baby on your hands, they're going to come out probably with some dry skin. Dry skin on a baby looks very much like peeling skin. If you've ever had a sunburn that's starting to heal, you'll see kind of peeling skin along the nipple line and the arms and the legs. You can do two things. You can, one, leave it alone and it will go away on its own, truly. Or you can moisturize those dry patches if you like. I would recommend a natural oil like almond oil, coconut oil. Those are my favorites to use. Or you could use a hypoallergenic fragrance-free moisturizer if you want to use an actual product. But just think when you look for newborn products, you want to go for hypoallergenic fragrance-free because that has less ingredient, right? I wouldn't put any oil or moisturizer on baby's face. We don't see dry skin on faces, and that can definitely get in their eyes. So avoid putting any product oil or anything on the face. So newborn rash. This is a newborn rash here. If you were to put your hand on this skin, it would feel nice and velvety, soft and smooth. Feels the same. It's not bumpy. It's not an infection. It doesn't bother your baby at all. It's truly just the skin adjusting to being out in the open air, right? We see that happen in the beginning of their life, and it will fade out by about 2 weeks old. So there isn't anything that you can put on this to make it go away any faster. Just know it's normal and just needs the tincture of time, as I say. Your pediatrician is going to be, or a pediatrician is going to be evaluating your baby every day before you go home from the hospital. If they pick up on any abnormal skin conditions, they'll be letting you know and arranging for appropriate follow-up, okay? So my details, people out there, you want to jot down, find a pediatrician before you go into labor. We'll ask you who your pediatrician is. You can actually schedule an appointment with a pediatrician to just meet them and talk to them when you're still pregnant. It's a thing. You don't have to do that though. Just keep in mind that most private pediatricians won't come to the hospital to meet your baby. Many hospitals will have a dedicated staff of pediatricians who take amazing care of your baby, and your private PD will meet your baby that first visit when you get home. If you're concerned about anything, call your pediatrician. Guys, a big part of the gig here is listening to people and listening to their concerns. You're new parents, you're gonna have a lot of questions and concerns. I want you to feel free to pick up the phone and call. It is part of our job. I don't want you to ever feel dismissed by a provider, by a pediatrician, by an obstetrician. If you have questions, please ask us or find a new one if you feel dismissed, right? Soapbox, sorry. More skin stuff. Okay, milia. This is milia. These little teeny tiny white spots along the bridge of the nose and the cheeks here. They look like teeny tiny white heads, but they're really just immature oil glands that are very, very typical and will just need time to dissolve back into the skin over the first 6 months. So you definitely don't want to put anything on this that won't help. You definitely don't want to squeeze any of those little bumps. Just give them lots of time. So this here is newborn acne. This is very typical. Not every baby has this, but many do. This is a withdrawal to mom's hormones, and again, just needs time. Don't worry, it's not a forever thing. It's just that skin adjusting. So these tiny little fingernails, believe it or not, are too long and need to be trimmed or filed down. Unfortunately, there isn't anyone in the hospital space that will cut nails for you. It's just not anything that we do. Best way to do this, guys, their fingernails are so tiny that I even cut one of my kiddos' finger when I was trying to trim her fingernails. And I'm like a NICU nurse, you know, so this can happen. Don't do what I did. Don't use these. I would just use a nail file. Nail files are just the most gentle way that you can file that nail down to the level of their finger, and you're not going to ever cut their finger on accident. It's also a great tip to wait until they're sleeping to trim the nails or file the nails. They will give you a relaxed hand. They'll open that up for you without fighting you and doing a fist. You won't wake them up too. So maybe you didn't notice your baby's nails are too long, but you see there's scratches on the cheeks. A lot of times when babies cry, they put their hands by their face and they scratch their faces. So if you see scratches on your baby's face, just check out the nails. If they're too long, give them a file down. Don't worry, it happens. It's so common that you'll see a lot of these baby sleepers will have a fold over piece in the long sleeve to protect their faces from getting scratched. Yeah, please wait until baby's sleeping before you trim their nails. I wish I had that advice before I trimmed one of my kids' nails once upon a time. Okay, changing diapers. So you always want to wash your hands before and after you change the diaper, right? That makes sense. So hand sanitizer is fine, soap and water is best. So you might be asking yourself, how many diapers am I going to be going through with this baby, right? How much do I need to buy? Well, we know your baby's getting enough milk to drink when they give us 6 to 8 wet or dirty diapers in a 24-hour cycle. So it's a good practice to just go ahead and change the diaper before you feed them. And then you will see that you're changing them about 6, 8, 10 times a day. So a lot of diapers you're going to be going through. Most diaper packages have 32, 33 diapers in a package. So that's roughly 4 days worth of diapers in one package. You'll need to buy a lot of diapers, right? So if you're going to pre-buy a lot of diapers, I would recommend buying a size 1 diaper instead of newborn size. You'll see the sizing at the corner. So the newborn size diapers, y'all, will fit a baby up to 8 pounds. Some of you might have a baby that weighs more than that, right? I just don't want you to spend a lot of money on newborn size and have your baby grow out of them quickly and not be able to use them. So I would just recommend starting with a size 1, unless you got a preemie on your hands. Okay, dirty diapers. So poop diapers, you always want to change right away. Unfortunately, many babies will cry and let you know. A lot of times you can hear it, smell it. It's pretty obvious. So go ahead and bail them out if they've got a poop diaper. That said, I would never wake up a peacefully sleeping baby just to change a diaper. You want to wait until they're already up and wanting to eat. So boys, so you want to make sure you point the penis down into the diaper right before you close it. If you don't, it's going to point up. They're going to pee up out of that diaper, get that clothing wet, and you'll have to change the clothes too, right? So you want to make sure you point that down. My little guys out there who are not getting circumcised and have a foreskin, you don't ever want to retract the foreskin on a baby. Foreskin is physically attached to the top, and it would be extremely difficult and painful for you to peel that foreskin back, okay? The best analogy I ever heard was, if my finger is a penis and the foreskin is my nail, I wouldn't want to peel back my nail, right? That would really hurt. There's nothing underneath there. So you want to just wipe down whatever it is that you see. Sometimes I talk about circumcision in the chat. If you guys are interested, if you have questions about it, let me know. So girls, so you always want to clean from front to back, just like any other female. You don't want to be dragging poop up to where she pees. That can cause infection. Front to back always. Some newborn baby girls, not all, but some will have this temporary bloody vaginal discharge called pseudomenses. It's something that happens around the first week of their life and lasts for a couple of days. It is a withdrawal to mom's hormones and can be quite alarming if no one gave you a heads up. So I'm giving you a heads up. If you see that, just go ahead and wipe that off like you're wiping anything off that vulva from top to bottom. If you need more reassurance from your pediatrician, give them a call. What to use? Well, so as a real life mom, I saw this warm water, cotton wool pads, washcloth. Okay, so if this seems doable to you, I love that for you, right? But I thought, is there anything else that these parents can use? There is. There are wipes out there called water wipes that look like traditional baby wipes, but they are 99.9% water, and they are a lot more convenient than doing this to diaper baby, because you don't want to put a lot of extra ingredients on the skin inside the diaper, right? Especially in the beginning, because it can make that skin more susceptible to rashes in the future. So water wipes for out and about or for always. So there's no need for any creams or ointments, especially in the beginning, because you're changing your kids so many times a day, 6, 8, 10 times a day. They really don't even have the opportunity to get a diaper rash. Diaper rashes tend to happen when baby's sleeping for many hours and they have a wet diaper and they're sitting in that and there's no airflow, can cause a bit of rash. But in the beginning, we just don't really typically see diaper rashes. You can save your money and use those when your baby is a little older. Baby powder, I don't love, because even if you very carefully sprinkle it on their bottom, it can get in the air and they can inhale that. If you are going to use baby powder, definitely no talcum or talc. That ingredient has been connected to ovarian cancer later on in females. Okay, this is the grossest slide that we have, but one of my faves. Your baby's poop is going to look real strange, so here you go. Let's walk through it. So, okay, day 1 to 2. This is called meconium. It is dark and thick and sticky. It's kind of like tar, and it might be a little more challenging to clean off of the bottom, but it's totally doable, and it's very temporary. So this happens for about 1 to 2 days when your baby is drinking milk for the first time and their little bodies are processing this new thing. Their poop's going to change, right? That makes sense. So this here from day 3 to 4 is called transitional stool, and it is loose and a little bit like this dark color here and a little bit like this yellow color. This is not diarrhea, guys. This is perfect. It's exactly how it should look. You might even notice there are some seeds in there. Those are undigested milk particles. I know, but that's how that looks. So say you're breastfeeding and your milk typically tends to come in between day 3 and day 5. Your baby at that time, their stomach gets bigger and they are taking in more milk. And so when that body's processing more volume of milk, the poop changes again, particularly between day 5 and day 6. You might notice extremely seedy poop like Dijon mustard. It looks exactly like that. And that is also temporary. Once their digestive system becomes a little more sophisticated and it can break down those milk particles, the poop gets a lot more pasty and a lot less seedy. We made it. Okay, let's change a diaper. I dropped something while I was talking to you. Okay. So a couple of things. We talked about sizing of diapers. There's a lot of different brands out there. I really don't have a brand that I just am devoted to. I would recommend getting a couple different brands, maybe 3 different brands, using them. Just see how they feel. How do you like them? How much do they cost? And just decide for yourself what you would like to use. But these diapers, I keep dropping stuff between these tables. Okay, so almost all of these disposable diapers will have a line down the center when it's very dry. You can see that very faint line. When it's wet, it needs to be changed. The line appears, you see? So that's a cool thing. If you see that line, it means the diaper is really wet and needs to be changed. Okay, so before I undo this diaper, I want to make sure I have everything ready and within arm's reach. I want to be organized if at all possible. So go ahead and pull out whatever diaper you're going to use. take it out of the package, make sure it's unfolded, make sure you've located your tabs, which always go in the back, and put that right there so you don't have to fumble around with that packaging. If you're going to use washcloth or cotton wool pad, have that handy, ready to go. If you're going to use wipes, then I would recommend just opening it up and getting one kind of halfway out and ready to go. You can fumble around with these a lot. So just open and see what it is that you're dealing with. Is there a lot of poop in here? Do I need to pull out a couple extra wipes? If it's just pee, one wipe will do. If I have a clean area of the diaper, I can just do one little wipe down the genitals and fold that shut. I have a curl baby here, so I'm going to be really intentional about cleaning from front to back. And there are other folds too that you want to wipe. Now, if she's had a big poop diaper and there's poop back here, best way to do it is to just grab their feet and gently lift them up off of the table. Once she's already lifted, you can slide the dirty stuff away and slide in the clean diaper. And pull the front part of the diaper up over the belly, nice and flat. Reach around with the other hand here and fasten your tabs. And if you have a boy, remember you're folding the penis down right before you shut that diaper. And see, these are Velcro, so you can adjust them as often as you like. Okay, so don't be afraid to make this really snug, guys. You should be able to put maybe 2 fingers in so that it's effective and doesn't leak. I see a lot of new parents diapering like this. And this is just gonna leak like crazy and not help anyone. So don't be afraid to make it nice and snug and comfy. Okay, if it's a little big, then I can fold down the top just so the belly button's not on the inside. This is important when that cord stump is still attached, and we'll talk about that in just a moment. The back portion you wanna leave all the way up so that it gives you maximum coverage for any blowouts that might happen. And then your dirty stuff, you can just put the dirty wipe in the dirty diaper, roll it up, use those tabs to just shut it, and you have a contained dirty diaper that you can throw away. So of course we have a diapering video on our Instagram. Give us a follow at the Baby Academy US. Yes, the nurses will change diapers for you while you're in the hospital, but I recommend just getting in there, and especially my partners, be a pro diapering person before you get home from the hospital, and you'll just have that one extra skill, right? So a little unsolicited parenting advice here, it's solid. So we all have expectations of how a major life event will be versus the reality of how it actually is, right? So parenting is a big example of this, whether it's bathing mishaps, poop accidents, or a host of other unexpected surprises. Remember, everyone's baby is different. Every day can be different, right? My advice is to just give yourself as much grace as you can, to have good days and bad days, and a sense of humor if you could. That'll help. So more advice here. ABCs, ask for help, lean on your partner and support network. They've got your back. Hopefully you have a network of friends, family around you that is excited for you and they want to help you. Sometimes it's hard to know what to ask from people. When you are vulnerable and you have a newborn at home and you're in the weeds, it's hard to know what to ask for. So you could potentially sit down with your partner and talk about what you would ask from certain people, what you want to do about visitors. Don't be afraid to ask for meals. You can throw it in the freezer, right? Price of admission for holding the baby, meeting the baby is a meal. That's a little shameless, but I did do that with one kid. And they brought meals. It was good. So B, browse the web with care. Don't believe everything you see on Instagram unless it's our Instagram. No, but we know this more and more every year that you can find anything you want online. It doesn't necessarily mean that it's true. We really want to be a resource to you all. We are a platform that is built and operated by practicing healthcare professionals that are always looking to the evidence, sharing best practices with you. So be a good consumer of information. So classes, attending a modern childbirth class that focuses on what's practical and shows you what things are like in reality is so important. That is why I'm here today. This is how much I believe that this is true. There is an entire body of evidence out there, guys, that supports that people who take childbirth classes before giving birth actually have better health outcomes. So more benefits here. Empowerment. So 97% of women who took a childbirth class said that it helped them feel in more control of their journey. Yes, this is all probably brand new experiences for you, but it doesn't mean that you can't be a little prepared and feel empowered, right? I think the best medicine for those that fear and anxiety you might feel kind of going into closer to your due date, start to feel a little scared. It's very normal. Our culture does a lot to scare us about birth. It doesn't have to be scary. Best medicine for that, y'all, is to just take a class and empower yourself with information so that you know what to expect, right? So that in the back of your logical mind, if you're in transition in labor, you know what that looks like. It's a lot less scary that way. So 94% of women who took a childbirth class said that it helped them make the right choices for them and their baby. You're going to be presented with a lot of decisions that need to be made. It's overwhelming, but we want you to be an active participant in your own care. We want you to have agency in decisions that are being made. So peace of mind. So we want to prepare you for the things that will happen, like having a baby, but also the things that we hope never happen, like choking and CPR. So over 80% of women experience some level of mental health challenge postpartum. Educating yourself on what to look out for is so important, as early intervention is key. This is so important, y'all. 80% is a huge number, and this tracks in my practice. If you have, we say postpartum depression, but it's so much more than that. We're trying to rebrand this as postpartum mood disorders, postpartum anxiety, adjustment disorder, obsessive behaviors. If you have any history of depression or anxiety or mood disorder, you're at higher risk for postpartum mood disorders. If you have any history of sexual trauma, you're at higher risk for postpartum as well. So we want you to know what that looks like for you so that you can reach out for those resources, right? Maybe it's medication, maybe it's therapy, maybe it's both. This is something that so many of us struggle with. Okay, what would you learn in a childbirth class? So topics covered at the Ultimate Childbirth class from the Baby Academy, of course, all things labor, but practically speaking, y'all. So I send so many people home in triage still pregnant because it's not time yet, right? And they're not very happy with me. But if you've never gone through this before, how do you know when it's time, right? So this class is here to help you navigate that. The signs of active labor versus that early labor. When do you go to the hospital? What's a birth plan? Why do I want one? How would I write one? What can I do to get through the pain of these contractions, right? Breathing it seems like kind of a vague thing, but can be extremely helpful getting you through the pain of those contractions. We talk about drugs, we talk about epidurals, we talk about when you might get one, we talk about pain medicine, but we also talk about the other things that can get you really far in your labor before that epidural time. If you are planning to have an unmedicated childbirth, we absolutely believe you can, but odds are you'll be able to pull it off if you prepare. It's really all in the preparation. So if you want an epidural in the parking lot, class is still for you. You would have to have some techniques before you get there, right? Love that we talk about C-sections. Many of you will need a C-section for a medical reason. 30% of y'all laboring with your first baby will end up with a C-section you didn't plan for. That's the statistic now. So we want you to know what that might look like for you so it's a little less scary. What to put in your hospital bag. So love that we talk about inductions too. Many of you will need a medical induction, but a lot of you are going to be presented with the idea of an elective induction. Hey, do you want me to induce you when you're 39 weeks? So we want you to know what that process looks like for a first-time mom so that you can be an informed decision maker, right? That's a good example. We talk about vacuum and forceps assisted deliveries, what positions you can be in, push your baby out, have contractions, skin to skin, the benefits of that. The role of the support person. So real life labor is really the partner engaged in um, helping her get through this labor, right? It's not the movie version of someone shouting at their partner. We know that you will get further along in your labor, that um, your labor will progress uh, faster if you are supported by someone you know, love, and trust. So that's your partner, right? We want to equip them with tools to help you. The fourth trimester, what is that? So that's the first 12 weeks you're home with your baby. I call it the Wild West. We spend so much time preparing for labor that we forget about this part where you spend the most time, right? And so we want you to know how to navigate changes in your body, your breasts, with breastfeeding. Maybe if you don't want to breastfeed, what to do there. How do you know when your kid's hungry? How do you get a good latch? How do you sterilize a bottle? How do you burp a baby? And of course, bonding tips, mood disorders. And then baby first aid, choking and CPR, how to baby proof a home, how to manage a burn, car seat safety. So I think there's a lot that makes us different as someone who's seen all the offerings out there. Of course, the things like labor, birth, and potential complications, but also this postpartum piece, the emphasis on the fourth trimester, I think is really valuable for everyone. So the convenience factor would be this is online. You guys are from all over the country. You can either do this over a one-day session on a Saturday, or you can break it up into 2 consecutive Saturdays if you want. And there's a recording, thank goodness. You can listen back, watch back as often as you want because it's a ton of info to take in one sitting. And so as a special offer, the Ultimate Childbirth class also includes baby first aid, so you are ready if an emergency arises. Okay, back to it. Cord care. Well, what's the cord? This is your baby's umbilical cord. This baby was just born, well, because the baby catcher's here, but this cord is blue and thick and pulsating. So what's going on is your baby right now is in the uterus and is being supported by this organ called the placenta. The placenta gives your baby all of the blood, oxygen, and nutrients that they need to grow and survive via this yarn or this umbilical cord. So when your baby's born and they're taking their first breath, this thing still continues to work, it still continues to pulsate and deliver blood to your baby until the moment it's clamped, right? Once it's clamped and cut, it's no longer of use, and you want to just let it dry up, shrivel up, and fall off. Okay, so there is a practice called delayed cord clamping that I would love to talk to you about in the chat if you're interested, but you can wait several minutes to clamp this off to give your baby some extra blood from the placenta. So day 1, this is what it looks like, the cord. Don't worry, you won't have to take care of a big segment like that. It's more like this short. The nurse will take the clamp off before you go home. Remember, the name of the game is to just let this dry up like a scab, shrivel up, and fall off. So day 3 to 5, it should be looking like a scab here. And then day 7, it will fall off on its own. You're not going to pull it off. It's just going to fall off spontaneously. So we don't recommend that you clean the cord. Remember, you want it to dry up. So definitely no soaps or ointments. You want to try not to get it wet if you can. If it's falling off at day 7, then you're really just having to navigate one bath here, which can very much be a sponge bath if you like. If you accidentally get it wet, don't panic. Just know that moving forward, you want to try to dry it out if at all possible. So you want to let it air dry. What we mean by that is just folding that diaper down and not putting it inside the diaper, but you can certainly cover with clothing. And it usually falls off at around 1 week old, plus or minus a few days. You'll just notice that it's kind of off to the side when you're diapering once. And you can either throw it out and you do whatever you want with it, up to you. So if you're concerned about how this looks, call your pediatrician. So, in 20 years of taking care of babies, I've seen this twice, so it's really rare. But if you see any yellowish green discharge coming from this area here that doesn't smell good, maybe the skin around the belly button is hot and puffy, seems to bother your baby when you handle it. If any of those things are going on, give your pediatrician a call. That baby needs to be seen. They need antibiotics. That's a serious thing if they do have a cord stump infection. Um, yeah. Okay. Any questions for me on bathing babies, skin and nail care, changing diapers, and cord care? So we're going to open up the chat and see what questions you have for me. Hi, Melissa. When can you start to pull back the foreskin? So I have read that you don't pull it back until your son can do it himself. So long time. Hi, Jocelyn. Can you please talk about how to clean the genital areas? So really the most important things for girls is front to back, okay? Just front to back. And for boys, you want to make sure you're not pulling back foreskin. You just wipe down whatever it is that you see. Yeah, those are the main points. Hi, Sarah. Is there a good place to find information on the benefits of circumcision versus not? So, we could probably create some content for you about benefits versus not. I'll go through some. I like evidence-based birth. They have a lot of information that's very research focused on things like circumcision. You could check that out. But circumcision is an optional practice that does not have overwhelming health benefits. But let's go through them, okay? So benefits of circumcising would be, by removing the foreskin, you're reducing his risk for getting a urinary tract infection during that first year. However, normal anatomy of baby boys does not lend itself to UTIs very often. They don't get them very often anyway. That's one. Diseases of the foreskin are eliminated if he doesn't have a foreskin later on in his life. He is less likely to pass sexually transmitted infections onto a partner if he doesn't have a foreskin, so that's another benefit. The things that are outweighed. So the things that gave me pause as a prospective mom to boys, I didn't know the gender of either kid. So I really struggled with consent if it wasn't something that was medically necessary and I couldn't ask my child about that, especially pertaining to their genitals. Why would I do that? That gave me pause. But there's also thoughts that there's increased sensation with sex if you have a foreskin, but you have nothing to compare it to. I don't really see how could you compare it, right? If you've never had a foreskin. I know that it is very valuable for many families, cultures, religions. I get it. So if that's you, you honor what your practices are. But if you are just looking at it from a health benefit standpoint, I don't think it has overwhelming benefits. We normally circumcise babies right before you go home from the hospital. So for kids who are born vaginally, it's day 2. If baby's born via C-section, it's day 3, day 4. So it's pretty early on that you're asking baby to figure out how to stay warm in this outside world, how to eat, how to comfort themselves, and then you're doing a circumcision on top of all that. Seems like a lot for a baby to do in 48 hours. So if you want to circumcise, you don't have to do it in the hospital. You can do it with a pediatric urologist, outpatient. You can wait a couple of weeks to do that. The benefit of that would be, your baby's had a little time to adjust to being here. He's figured out how to latch on the breast, right? The best way to comfort a baby after a procedure is to put a boob in their mouth. It just is. And so you're better able to do that if he's a bit older and a better breastfeeder at that time. So lots to consider. It's a tough one, though. I mean, we were a house divided on this, so luckily I had girls. Hi, Madison. For the water wipes, do you recommend a warmer? I don't, Madison. I found that the warmer really dried my wipes out, rendering them useless. So I didn't really like my warmer. Hey, will I get access to this recording? If you sign up for the childbirth class, and I'll tell you more about that after the break, then you will get access to this recording. Mhm. Yeah, cord infections are very uncommon. So in 20 years of taking care of babies, and this is included in a high volume neonatal intensive care unit, I've seen this twice. So I don't have an actual number for you, but it's very rare. Mhm. Hi, Juliet. Can I chat more about delayed cord clamping? Yeah, for sure. Okay, so delayed cord clamping is uh, the act of not clamping this cord for many minutes so that your baby gets extra blood from their own placenta. So, the first 3 minutes after your baby's born, this will continue to pulsate and deliver oxygenated blood to your baby. So, the benefits of her having extra blood volume is she's better able to send blood or perfuse these vital organs, the heart, the lungs, the brain. It helps very much with that transition to being here, having extra blood volume. She's also less likely to be anemic at 6 months old if you've done delayed cord clamping. Also, keeping mom and baby together, skin to skin, has its own set of benefits. And by doing delayed cord clamping, keeps moms and babies together, skin to skin, longer because they're physically attached to one another. A lot of people ask me, how many minutes should I delay for? And it's really more when the cord stops pulsating. So you can see in this picture here, this is very much pulsating because you can see the blue color. If you were to put your fingers on it, you could feel it pulsating. Now, when that transfer of blood has been made, you'll see that the cord gets pale like this. And if you were to put your hands on it, you wouldn't feel pulsation at all. And so that happens to take about 3 minutes for that to occur. So the one drawback to delayed cord clamping is increased risk for jaundice. However, that the benefits of delayed cord clamping far outweigh that risk. Um, we screen all newborns for jaundice, and it's something that's very easily treated. So, but that's worth mentioning. Want to do delayed cord clamping? I would recommend talking to your OB or your midwife about that, making sure you're on the same page, and then you would put that in your birth plan. Let your doctor, your nurse know that when you're about to deliver. Just remind them of that. If you are wanting to do a separate thing called cord blood banking or tissue banking, it's hard to do both of those things, right? So if you think about, there's extra blood here up for grabs after she's born, it either goes in a bag for the bank or it either goes back to the baby, right? One or the other. So cord blood banking, it's not free. So there's a fee with the initial setup, and then there's an annual fee, but it is having your baby's stem cells on hold for treatment of a sibling or treatment for a blood disorder for someone who's a match for that. So I think I'll stop there. Yeah, 3. So Alana, the right amount of time would be until the cord stops pulsating, about 3 minutes. Hi, Abby. What age is the best time to start using diaper ointments? I would wait until baby's sleeping through the night. That way, you're saving your money and you're not likely to see a diaper rash before that time. Hi, Denise. Are there benefits to cloth diapers? There are many benefits to the environment, right? Very, very, these take so long to decompose if that is part of your values. A lot cheaper to cloth diaper too, but it is a lot more labor intensive, right? It takes more work to cloth diaper. If you have if you can use a laundering service, you can afford that, that might really help. It is hard to keep baby more dry with cloth diapers because you don't have this moisture wicking material here. I cloth diapered one baby, but not the other. The first one, right? Of course, cloth diapered, and then I switched to disposable diapers. But the second, because my values changed, I needed the convenience more than the environmental concerns. I know, real talk here. Okay, this Snappy Baby fastener, I couldn't live without this. So for some reason, this helps. It has teeth here, and it really helps secure that base layer in your cloth diaper. It really helped with leaking for me, so I found that to be extremely useful. Hi, John. When do you schedule a meeting with the pediatrician? Yeah, sometime in the third trimester. Yep, so you can just call the practice that you're looking at and say, hey, I'm expecting my baby next month. Can I meet with the pediatrician? And they will let you know whether it be a meet and greet in a group setting or a one-on-one, a 10-minute thing. And you can sit with them and ask them a couple of questions about their philosophy, their breastfeeding support, their views on vaccines, antibiotics, things like that, and just do a vibe check, see how you like them. So, and remember, you can always change your pediatrician. We don't take it personally, okay? You can always vote with your feet if it's not a good fit. How to avoid an ugly belly button? Well, unfortunately, there is nothing you can do to inform the shape of your belly button. It just is what it is. But I think they're all cute. How long before you can increase the bath frequency from 1 bath a week? Yeah, so when they're a month old, you can bathe them as often as you want. So during the first month, just 1 bath a week. In regards to baths in the hospital, are baths still an option if delivered via C-section, or are they given automatically? Yeah, Haley, thanks. So if you don't tell us to delay the bath or no bath, they will bathe your baby. They normally do it in the newborn nursery. So what will happen is around 36 hours of life, the nurse will take baby to the nursery to do some blood work. That all babies get blood work to screen for jaundice, and to do a newborn screening test. It's kind of basically what they're doing. And during that time, they'll do the bath. A lot of baths in the hospital are with soap and everything. So if you feel like these recommendations are making sense for you and you want to go with these recommendations, I would just say no bath at all in the hospital. Hi, Cherie. How many diapers do we go through a day for a healthy fed baby? Yeah. So my details people out there, 6 to 8 wet or dirty diapers. We know your baby's getting enough to drink when they're giving us 6 to 8 wet or dirty diapers. Yeah, so the umbilical cord is cut normally here. So what will happen is the baby catcher, the doctor or midwife will put 2 clamps on, they'll put a pair of scissors in your hand because you're going to be like a deer in headlights because your kid was just born, right? And we'll say, cut right here, and you'll cut. And it's usually about that, an inch. Hi, Megan. Yeah, so can you clean around the cord area with alcohol? You can. So she's right. So in generations past, we would clean the base of the cord, the belly button, with rubbing alcohol. That was a very common practice. They did a big study to see if there were differences in rates of infection between babies who had their belly buttons cleaned with alcohol versus babies who just were left alone, and there was no difference in rates of infection. So if you feel like your baby's cord is looking a little gamey and you're worried about it, you could swab that with some rubbing alcohol, and that certainly help it dry out, right? Hi, Carly. What about doing cord blood registry? Yeah, so this is the cord blood banking that I was talking about a minute ago. Is the cord still going to be attached then for the first 7 days? Yeah, so okay, so good question. So no matter what you decide to do, once the cord is cut, whether you're delaying it or not, then your baby catcher will remove the clamp that's there and collect whatever cord blood we need from this cord. Okay, and so that's something we're doing down here while you're bonding with your baby. We put them in specimen bags and send them off. Um, it's hard to do both delayed cord clamping and banking, right? Remember, there's extra blood up for grabs. She either gets it or the bag gets it. It's hard to do both. But in all scenarios, your baby will have a little tiny inch of a cord stump that you'll have to take care of. Hi, Abby, circumcision care. How long does it take to heal? What's the circumcision process after birth? Yeah, so we'll do it right before you go from home from the hospital, unless you want to do something different. They will give you a packet of tiny gauze strips that are coated in Vaseline, and you'll have to, with your diaper changes, the first 3 days after circumcision, you'll have to put a piece of Vaseline gauze on the tip of the penis to keep it moist, so that that raw tip doesn't stick to the diaper and bleed every time you change the diaper. So it's really those Vaseline gauze strips that are the trickiest thing to deal with the first 3 days. I wouldn't bathe baby 24 hours after, wait 24 hours after circumcision to bathe your baby. I also, when cleaning the penis, wouldn't use any traditional baby wipes. I would use a cotton swab with some warm water, and you just dab that area. Brands for baby wash. You know, I like the Honest Company, and I like Mistela. They're kind of pricey, but I like their stuff. But again, guys, you just have to go with what you like. I mean, people have preferences for cost. For there's so many variables there, right? So I'll just leave that up to you. Hi, Haley. Do I recommend putting Vaseline on the baby's bum after birth before the first poop to help with cleaning meconium? Yeah, I get this question a lot. I don't think you need to at all. Yeah, it's thick and sticky, but you can totally clean the bottom. Yeah, you don't need to do that. What kind of clothing should you have for the first 3, 7, 10 days, especially while the cord is still hanging? Yeah, so remember that as long as the cord stump is not inside the diaper, you can dress, okay? You can cover with fabric. So I would, and we'll talk about dressing after the break, but I would just go with cotton footy pajamas and onesies and things, and you'll see more after the break. Yeah, does circumcision cost anything? It does. Yeah, so all I can say is if you're going to the hospital, you will meet your deductible no matter what, and your baby will meet their deductible no matter what. Even if you have a low intervention en naturel birth within an hour of arriving at the hospital, you will meet your deductible. Okay. Outpatient circumcision is a bit more, you might have to do cash for a pediatric urologist, but you'd have to find out about that. But yes, it does cost. Hi, Haley. Is delayed cord clamping allowed when delivered via C-section? Good question. My answer is maybe. So I would talk to your surgeon about this. They certainly can't delay it for more than 1 minute because they're trying to navigate your bleeding and your safety. So that is a discussion best had with your surgeon. So I would start using products when baby is 1 month old. How will I know when the baby's peed in the diaper? How many pees can a diaper hold? So you know your baby's peed in the diaper when you see this line. Okay, so dry diaper has this line here, and a wet diaper, this line will appear. Okay, but you want to, it's just as a general practice, to change your baby's diaper when you're about to feed them. Go ahead and give them a change. I heard you don't want to use a baby wipe every time you change a diaper. That is pee only. Is this true, or is a water, or if it's a water wipe, it doesn't really matter? I would just use one baby wipe with a pee. Yeah, because you want to wipe that off of the skin. I don't know about Pipette brand. I would love to like have a brand day, but I'll always tell you the truth. I don't know about that brand. Okay, let's see what time it is. 41 past. Let's meet back at 50 past. That's a 9-minute break. 50 past. And we'll do the rest of the things. Okay, y'all keep your browser open so I don't lose you, and I'll see you in 9 minutes. Thanks for the questions.